At BD, we know that people with diabetes should receive emotional support, as well as education to help them better their quality of life, especially between their visits to the doctor. That's why we now offer the BD Diabetes Care app. The app builds on the work of healthcare providers, making expert knowledge and guidance accessible anytime a person needs it. Our goal is to help more people be engaged in their diabetes management and to provide interactive tools to help healthcare providers support their patients. Let us show you how our app works. Our registration process is simple. To show you how the app works, let's look at the experience of an injection user who needs support with injection technique. Let's call her Natasha, and our personal diabetes assistant is Bright. Nice to meet you. We won't cover hypoglycemia and other lifestyle content in this demo, but both topics are available features of the app. Here we begin customizing the experience based on the person's treatment regimen as well as their type of diabetes. We personalize the relationship from the start to make the experience relevant to the user. Our app experience is currently ideal for persons with type 2 diabetes who are new to insulin therapy or on multiple daily injections and need support, encouragement, and information. Natasha selects her injection delivery method to further tailor the experience. The app is built to expand to other profiles as well, and we are continually adding and updating our content to support a full range of persons living with diabetes. All of our topic plans are intended to build users' confidence, so they will be more aware of the benefits of insulin therapy and the importance of adhering to their treatment plan. Let's start with a user who doesn't fear injection and is comfortable fitting insulin into their lifestyle and wants to learn best injection practices. The content spans a diverse set of topics, including common learning areas such as site rotation and other best practices for injection therapy. For injection technique training, we provide information in a variety of formats to appeal to different learning styles, including video. And for those who don't want to sit through a video every time they inject, we also offer tutorials, which show each step of the injection process in bite-sized, easy-to-follow visuals. Tutorials allow users to learn information at their own pace. Our step-by-step guide to injecting is designed so that the user can have their phone on a counter and have both hands free to administer the insulin pen or syringe. With the tap or swipe of a finger, they will have the confidence to inject properly every time. We also provide emotional support, so users have somewhere to turn when they are struggling to stick to their plan. In addition to deep dives on topics like injection technique, the app's AI, Bright, can answer basic questions about diabetes and provide in-the-moment information to help users make informed choices. For instance, when a patient is deciding what to make for dinner, we can provide healthy recipe content, which fits well into the person's lifestyle. Users can ask medical questions and ask for definitions, and also search for healthy recipes. We offer trustworthy advice after they leave the doctor's office and between visits. We also support the patient in other key ways, including the ability to utilize blood glucose logging features in several ways, from manually entering their blood glucose, logging by voice, connecting an Accu-Check meter, and also connecting to Apple Health. Additionally, Natasha can log insulin by brand and dose. Connecting to Apple Health makes logging even easier. We just need the user's permission to automatically sync their data. And now, the person with diabetes can log their steps and blood glucose data into the app seamlessly, helping us assist users to identify trends and insights about how they manage their condition. For example, when Natasha logs an elevated blood glucose above the recommended target range, she's guided through a series of possible causes and offered content that can help understand why she might have had a high reading. This can help to better manage the situation in the future. The app also lets users know when they are on track and shows them how their behavior can impact their blood glucose in a positive way. The logging and tracking functionalities allow Bright to provide stats and trends so the person with diabetes can easily see their progress. And Natasha can export her data easily if she wishes to provide it to her healthcare provider, giving her provider a more complete view of her individual challenges. We've also introduced goals to help users stay motivated between visits and form habits that lead to better self-management. Users take a brief survey that tailors their goals to their level of emotional and functional readiness for change. Bright may suggest reading an article, or in this case, logging blood glucose levels once a day for a week. Once a goal is initiated, the app tracks progress and provides supporting content to help Natasha overcome hurdles. We make it simple to track progress by visually indicating how she's doing. And as Natasha makes progress on these goals, we celebrate her accomplishment. These small celebrations recognize the progress users are making while keeping them motivated to stay on track. All these features are designed to support persons with diabetes between visits and keep them engaged with their treatment plan. Search for BD Diabetes Care in your app store to download now.